if you ask for money, you're going to get advice. And if you ask for advice, people may give you money. And I think that's really important, and that you take that advice, right? You guys are laughing, but you've been there,
well,
right?
You just Sesame Streeted the whole story right there.
Welcome back to MasterMined. I'm Mark Scrivener, one of your co-hosts. I've got Lee Pepper and Jeff Skillen with me. Guys, great to have you here today.
Good morning, Mark.
Hey, Mark. Good to see you.
This is awesome. Well, this is going to be a great episode. We're joined by Mike Lifshotz from Hatch Compliance, which he was the CEO and founder of that, but now he is the VP of Business Development with Kipu after the acquisition in 2024. So, Mike, it's great to have you on the show today. Really appreciate you taking time out to give to all of the listeners here.
Thanks so much, Mark, Lee, and Jeff. It's awesome to see you guys. I'm excited to be on this with you.
Mike, always a pleasure. So, if you would, let's take a little trip into a time machine, okay? The time machine, I want to go back. I'm not quite sure how many years it was, but it was a few years ago, and I believe it was the NCAD conference in Baltimore, where I met Renee, and Renee was walking around with her PC, this big giant PC, and she was walking from booth to booth, and she's like, I've got an idea for something, and I would love to show it to people. And that was, of course, the beginning of Hatch Compliance. And when Renee showed it to me, I was like, oh, Renee, you are completely onto something here, and this is incredibly exciting. So I'm now on that time machine. I hope you're on that time machine. Renee's not with us, but tell us, like, from your perspective, like, back to those early days, talk to us about Hatch.
Funny, Renee remembers that conversation with you because you called her a unicorn.
I did.
And she remembered that, and she said, I remember the first time I met Jeff, he called me a unicorn. So, yeah, it's actually a really cool story. A lot of times people create systems and solutions or products out of a desire to make money. Renee built this out of her own need. And that is really important. So she was responsible for building and growing a treatment center in South Florida. And when she started, they had one location, and it was a small 8-bed detox. And they started to scale. And as they started to scale, Renee found that compliance was a very big problem. And the more locations they built and the more states they got into, she started seeing that the process that they had for compliance, which most people still use today, is really ineffective. And that's paper and spreadsheets and a bunch of different software systems, and nothing talked to each other. So what was happening was it was just inefficient, and it took way too much time to do as well. So Renee was trying to find a system that managed all aspects of regulatory compliance, from HR and learning management system to operations and clinical documentation and medical documents, and nothing existed. So she decided to build it. And I think the most important thing she did was consolidated all those systems, but broke down and defined all the regulations from the states and regulatory bodies in that system. So the system she built was standardized, but standardized to meet regulatory needs. And she built this, and it was kind of funny. She goes out with the head of the state inspector in Texas, Tom Millenbach. I love that guy. It wouldn't have been anywhere without Tom. And that was in 2018. And Tom took Renee out to a bunch of treatment centers, and she was showing the system and talking about it to people, and everybody loved it. I wasn't in the business at this point. It was just Renee. She built the software, by the way, on her own in 6 months. She did this.
I was blown away when she showed me just the rudimentary stuff that she was doing, and I was like, "Who's helping you with this?" And she's like, "Oh, I'm building it." And I'm like, "Okay." And that's where I just popped the unicorn thing on her, because it was absolutely the truth.
Well, what nobody knows, or most people don't know, and this is actually going to tie into the rest of the story and where we are now, is when Renee built the compliance system, she built her own EHR as well, because she recognized the value and the importance of having your health record data and your electronic health records in the same system or connected to your compliance system. So even in the very beginning, that was part of the concept. And so kind of pulling it back, Renee went around with Tom. He introduced her to a bunch of treatment centers. And I said to Renee, I go, hey, what did people think of your system? And she said, everybody loved it. We got such great feedback. Everybody loved what we were doing. And I asked her, how many deals did you close? And she kind of looked at me funny and goes, I didn't close any deals. She says, but I'm sure everybody, I'm sure we will close deals, just didn't happen yet. A couple weeks later, I asked her the same question and same answer, nothing yet. Finally, about a month later, I said, hey, Renee, you mind if I see your demo? Like, how are you following up with these people? What's going on with how these presentations went? And she says, what do you mean following up with them? I go, well, how are you getting these across the line? And she said, they're not just going to call me when they're ready to buy it. So at that point, I was curious of what she was doing. And my background is sales and operations and growing businesses. And I watched her demos. And I watched them because she had a GoPro set up on the counter, and watched this GoPro video. And she was doing 2 and 3 hour demos. And I was shocked that they were willing to sit there for 2 or 3 hours and see what she was doing. But Renee was so passionate about each functionality being so valuable for each provider that she was able to keep their attention for that much time. And I thought that was really cool. And again, I didn't really know anything about behavioral health or healthcare or even what the software did. I just knew that Renee is brilliant. And I knew that if she was able to get the head inspector of Texas to take her around, and if she was able to get these people interested for this long of a conversation, she had something. And I said, I'm going to help you out. And she goes, no way. Husbands and wives don't work together. Not going to happen, right?
Is that when she introduced the prenuptial agreement?
I don't know what the rules are for language on this podcast, but I can tell you there was some 4-letter words that were said about what happens when husbands and wives work together, and I value our relationship too much to do that.
So, Mike, PG-13. Okay?
Yeah.
Just keep it PG-13 today.
Well, then I guess you're going to get you get the point of where I was going with that. And I said, Renee, look, I'm going to go in your desk, and I grabbed the stack of business cards out of her drawer, and I started calling people, talking about Renee's compliance software. Again, I didn't know what compliance was. Didn't know what Renee did. Didn't know really anything about. I didn't know the difference between a clinician and a doctor at that point, and nobody cared. Nobody cared, probably because I didn't know what I was talking about, but at the same time, no one cared about compliance. Nobody was looking at compliance, and I think it's important to mention that compliance, people didn't care about it because the processes were so wonky and so cumbersome and so time-consuming for the staff that people just looked at compliance as, hey, we got to do this to get our license. Anyway, long story short, I called up that same inspector and I asked him to take me around. We used GoToMeeting at the time because there was no Zoom. And Renee says, you're going to go around with this guy and sell our software? And I said, I'm going to ask them questions and get them to talk about their pain points. You're going to log in and show them how to fix it. And our first meeting, we closed a very large group of treatment centers. Our first meeting. Second meeting, same thing. Third meeting, same thing. We had clients on it right from the beginning. And that was the importance. We had these early adopters who had a vision similar to her, and said, we're going to help you. We're going to help you kind of figure out how to make this better. And that was really it. They partnered with us and we worked together. There's, more to the story, but I'm not going to bore all you out with all the details.
Well, and Mike, you had such rapid growth, and without giving away your business secrets, how do you go about even pricing your offering for something that's new to the market, that you guys kind of homegrown built? Like, how do you decide how you're going to price it,
and think about it, it's like people didn't even know they needed it
Yeah.
until you showed them the solution.
Yeah.
So it's like that is a really unique pricing problem.
Yeah.
What was really interesting about pricing too is you have to be able to show them the value. If a conversation comes down to pricing and the decision comes down to pricing, you haven't demonstrated the value enough to the person that you're selling to. And I think that's really important. When we first started, we were charging, I think it was like $10 or $12 per user. We charged on a per user basis. And what I started doing, and I have a background in growing and creating businesses. I just started raising the prices until about half the people started pushing back. And then I said, all right, I think we're about there. And that's how that worked. And we weren't charging implementation fees at that point. And so again, it was a free implementation, but you find that if you have a free implementation, then people don't really respect your time as much. And so I did the same thing with implementation, add a little bit, add a little bit, add a little bit. And that was really how we figured out pricing. What's really interesting is pricing now is all based on locations as opposed to users. And the reason is a lot of times people were hesitant to put all of their employees and contractors on the system because they felt that, well, maybe we can shortchange it a little bit or we can share a login. But, one of the things that I think is really good about what Kipu did was they recognized if we do locations, then everybody sees the value, the whole company can do it, and it doesn't affect their price. And their pricing doesn't change month to month. So it was really... I like the way it evolved into locations, although I did push back on it a lot in the very beginning.
Well, Mike, you've got a typical founder story of the pricing and how you come about it. I guess, you also mentioned I didn't even know anything about this industry when I got involved. Who were some of those early mentors that maybe helped shape you to what you are today from a knowledge standpoint of the industry? Was it just Renee, or did you have other people that leaned into you?
Oh, it's hard to answer that question without getting emotional, because Tom Millenbach was so important for me. He passed away a couple years ago. Tom Millenbach was awesome. Renee, I've learned a ton from people like Glenn Hadley, who you guys probably know. Ben Dittman taught me a lot. Dean Fitch. Gotta give my hand up to Michael Castanon. People like that have taught me so much. Jeff, I've learned a lot from you. I'm just meeting you, Lee and Mark, getting to know you guys, and I'm excited. But these are some of the people that were really influential to me. And then, just getting an understanding from people that I've become friends with at the Joint Commission and CARF, who talk about the importance of compliance and really the value of it. That's really where a lot of this came from too.
Mike, you talk about Joint Commission, you talk about CARF, and I'd be curious how you would characterize providers' relationships with them. Do they see that as adversarial? Do they see that as supportive? How do they look at those bodies? And then how do you help navigate that relationship?
I love that question, because one of the things that's so important about my role here is explaining to providers that it should not be an adversarial relationship. Putting ourselves in a provider's shoes. When we manage compliance in a way in a way where we have limited oversight as to what's going on, what ends up happening is we kick the can down the road, and our staff kicks the can down the road. And we've got a 30-year window between our surveys. So we don't necessarily know what's going on, and we miss a lot of things. And then we know that Joint Commission's coming in 6 months. Now we're panicking and we're freaking out. How do you not have an adversarial relationship with the surveyor when you are scrambling to get all of your compliance stuff done, and you're trying to catch up, and you're also trying to take care of clients and keep your staff happy and do all the things you have to do? So a lot of times these relationships with the surveyors, whether it's the state or the accrediting bodies, is an adversarial and scary, because these people hold a lot of keys to your business. So yeah, I think that is old way of thinking. Now, one of the things that we have done is we give you a compliance score, real time. And this way, you know, where am I versus where do I need to be at any time you can check in. So where this becomes really helpful is you don't have those stress out moments as you shouldn't have those stressed out moments as you're building towards it. And you can catch things a lot sooner. You can put your documentation in and do it a lot sooner. But also, it should be a tool. And one of the things that I try to talk about is how compliance should be a tool that when Joint Commission comes, instead of feeling like they're looking for something to punish you or something to cite you with, you should feel like your Joint Commission surveyor is there to look through your information and to give you suggestions on how to do things better and to work consultatively. If you talk to any surveyor or state or accrediting body, their job is not to cite you. Their job is not to be punitive. Their job is to consult and to help you improve your business, reduce your risk, improve client safety, and improve your outcomes. But if you're managing compliance with the thought of, I just got to get this done, they don't have the same value, or they don't see the same value. So that's what I would say about how it is versus how it should be.
And then obviously the software is helpful in terms of putting everything in one place and you get that real-time score. What about from the sort of human side of it? So Mike, do you or Renee or people at Hatch actually hold people's hands in making that happen?
So a couple things. First, we're Kipu Compliance now. So we are part of
I stand corrected. Okay. So,
so as of August of last year, there was no more Hatch. We're now Kipu. But what the system really does is it does hold people's hand, because one, you've got these real-time reports and real-time guidance of what is done versus what needs to be done, but you also have the ability to easily create that documentation. You've got standardized instructions. So if Mark creates an infection control report this month and Jeff does it next month and Lee does it the following month, you've got the same set of instructions. And that is really, really helpful. You've got the same guidance. You've got links to all the documentation that you can use to help inform these reports as well. So it not only does it save time, it just makes your reporting more valuable organizationally.
Yeah.
You know, Mike, I was going to ask you, so with compliance, you've got Joint Commission, CARF, all the different state agencies. How do you guys stay compliant with all of their requirements? I mean, that's a huge number of folks you guys have to interact with to keep updated.
So Kipu has an entire team of compliance experts that are constantly monitoring this. We've got people that were former surveyors. We've got people that are clinicians. We have a whole team of people to make sure that we stay on top of the regulatory requirements. And we also have a development team and product people who also help with this. So one of the important things, Lee, to answer with that question, and one of the biggest risk points that providers face is what happens when a regulation or a standard changes. Joint Commission and CARF, they do it on a standardized kind of schedule, right? When Joint Commission and CARF are going to make their updates. That's one thing. States, very different. They get recodified kind of whenever. So if you're a provider and the state of Florida decides to make a bunch of changes, you have to catch those changes when they get made. Then you have to update all your documentation and push it out to all your staff, so your staff knows about it. Now, if you've got multiple locations, multiple levels of care, or if you're operating in multiple states, that's a huge problem, because then your time and your risk goes up exponentially. So what we've done to help people stay on top of that is when a regulation or a standard changes, we put out a banner if it's relevant to you. If it's relevant to your location, you get the banner, you know what the regulatory update is, and we update the documentation in all of your locations for you. So you don't get stuck wondering, oh man, I didn't realize Joint Commission just changed all of these requirements around emergency management. We do that for you. So that's how our regulatory team helps.
Mike, I know you had a couple year partnership with Kipu before, they acquired you. I guess take us to that point of where you and Kipu both saw something in the marketplace and you said, if we came together, we could offer a much stronger offering to, our clients.
Like I said, in the very beginning, we knew we needed to partner with EMRs. We either needed to build it or partner with it. And we've been partnering with Kipu since, I believe, 2021. We've been working with them. And, they're the industry leader. They're the industry leader. They're very well-respected organization, but also vision-wise for the future, we were really aligned. And that was really very important for us, not only to have product alignment, but also vision alignment for the leadership. And we like them as people. But yeah, they were our kind of target since the beginning.
Yeah. In the early days when you were getting your first clients, was there a feature that everybody latched onto with the compliance software that, hey, I can get in the door with this hook and then, we'll expand services? And then I guess even take it to today now with Kipu, how are you selling differently than you did even way back then?
So first thing is the learning management system. Our learning management system, I haven't checked lately, but the last time I checked was a few months ago, and there was something like 50 to 60,000 trainings a month being taken in our learning management system. And the reason why that was such a good hook to get people is if you're using any other learning management system, it requires that you, manually assign trainings to each person. And a lot of times, people are doing that based, taking a group of trainings, 20 or 30 trainings, and have everybody take them. And what happens is your staff is taking trainings they don't need to take. And that becomes very expensive, also taxing on the staff. Our system automatically assigns trainings to people based on what they do. So your techs aren't taking a DSM-5 training, for example. And it becomes very helpful for people. And then, of course, and I don't know if you guys have ever dealt with or seen what a spreadsheet looks like when people are tracking training.
Oh, yes.
And when trainings are due, you're 3-4 letters wide in that training spreadsheet, and you're manually tracking it. And our system automatically assigns the notifications based on when trainings need to be retaken, and it automatically notifies the users. So you're looking at, for 20 employees, you're looking at hundreds of hours saved just with that. It's a no-brainer, and that's the easiest way to get people interested and started, and that's how we've been able to do it.
Is it an optional feature within Kipu So you can just do the EMR and not subscribe to the compliance, or is it all? It's all one package when you subscribe.
So it's really important to mention, Lee, I'm glad you asked that. The compliance system is EMR agnostic. So if you have Kipu EMR and you want to use the compliance system, you can sign up for it. If you are using Kipu and you don't want to use the compliance system, you're not obligated to it. But it's also important that if you're using another EMR, you can still get the benefit of Kipu's compliance system. And that's really important. Now, you will have more benefit and more functionality if you're using Kipu's EMR with the compliance. You will have more benefit. But if you're committed to 3-year contract with XYZ EMR, you don't have to wait till that is done before starting with the compliance system.
Wow, I wonder if other EMRs are jealous, like that you could be using another provider and then they could be using Kipu for the compliance. That's a smart move on your part to make it available.
Thank you. You know, it depends, right? And this works the same with software providers as it does for healthcare providers. You've got some that are genuinely interested in the client's experience and the user's experience. And then you've got some that are out there that are cutthroat business people. If you're genuinely interested in the experience of the client, then why not use another, if you're, you know, again, I don't want to throw any names of any other EMRs out there, but if you're using this other EMR, why not support using Kipu Compliance if it benefits the clients? And I think that's really important.
I wanted to ask, do you guys work with any Canadian clients, or what about tribal nations or any other territories in the U.S.?
So we've had conversations with tribal nations. We've had conversations with Canada as well. Actually, we were working on a really cool project with Canada a while ago. But currently, what we're really focused on is building out and getting more states and levels of care built out in the United States. That's really where our focus is right now. There are obviously growth opportunities, and for the right opportunity, I'm sure they would be willing to consider those things.
Well, I think I speak for all of us. If you need help in the U.S. Virgin Islands or Puerto Rico, please let Jeff and Mark and I know. We're happy to head down there with you to do a discovery.
I can think of a few countries that could really use a solid compliance platform.
So when we were building this out, right, and we built state by state, level of care, by level of care, and I remember I had one provider from Hawaii reach out, and they're like, "Hey, can you build out Hawaii, or could we work with you in Hawaii?" And I called Renee. I was like, "Hey, I think we need to do a demo on site here.
Yes.
Let's do the demo on site in Hawaii, and we'll build it out." And she's like, and Chris, who was our third partner, and he was our chief operating officer, still with us today. And Chris is awesome. And Chris used to say, "Mike, is this going to add enough business for us to be able to build that state out?" And I'm like, "Well, it would be a nice vacation to do one in Hawaii." So if I do build the islands, I'll let you know for sure.
Great.
Well, so I want to shift for just a moment, because I know a lot of people that are listening to this podcast, they own programs or they're learning about programs. And when you think about the topic of compliance, I mean, most people think about it from sort of a defense perspective, right? So they're thinking defensively, how do we make sure that, you know, we can maintain good standing with, you know, crediting bodies, things like that. But they probably don't think about compliance in terms of offense, in terms of, can it enhance revenue? Can it actually create revenue opportunities? And my question to you is, Mike, can it?
Absolutely. So what I like to do is I like to break it up by who I'm talking to, right? Are you talking to a clinician, or are you talking to a founder, or are you talking to a private equity group that owns a bunch of treatment centers? Compliance is really a matter of protecting revenue and reducing risk is what the way we should be looking at compliance. So if compliance is managed effectively, it can help reduce your AMA rate, which definitely protects your income. It can also help you increase your length of stay if you have an understanding of what's going on operationally. I have a background in human resources and recruiting, and I understand the cost of turnover and the cost of an unhappy staff. So by being able to keep your staff longer and better educated and happier, we're also not only reducing our cost, but we're also improving our operations. So those are some of the ways that compliance can help. But then we also look at risk. And risk is really important, especially if you're a founder or CEO of a treatment center, right? Most people aren't buying treatment centers or creating these businesses because they want to give themselves a job, right? They're opening up a treatment center saying, I want to grow this, I want to scale this, or I want to just build this and then eventually sell it. And over the years, I've had thousands of conversations with organizations. And I can tell you probably on one or two hands how many times I haven't seen this come up. It's a situation where there's one or two key people who know how to use all the softwares at the organization, who knows what key fits every lock,
Yep.
and who knows where the skeletons are buried, right? We all kind of nod our head to that
Yep.
because that's really what we see, like I said, out of thousands of conversations, maybe a small handful. And that is a huge risk point. Not to mention, if you are looking to exit, what's going to affect your multiple other than introducing risk? So here, by being able to standardize compliance and being able to use a single tool to manage all of it, now, when that key person gets sick or quits or wins the lottery, now the next person can come in there and step right in, access all their information, access those systems, and move things forward. And Lee, as a technology person, I'm sure that's something that you've come across a lot of times in the past, is trying to figure out these crazy one-off systems of all kinds of different tools. So being able to streamline that into a single place is huge when it comes to compliance.
Well, and I can imagine a lot of places especially the smaller shops that Mark and Jeff and I sometimes come in and do a project for. It seems like the chief compliance officer position is like an added duty. It's something that's just kind of assigned. Very, very few.
It's a post-it note on the board.
Right. Very few companies have a full-time trained, chief compliance officer. I can imagine the tools that you all have built can really help mitigate that risk for a lot of smaller, mid-sized companies.
It's funny you say that. The amount of organizations that I'll call in, and there was an ops director who is now compliance director, or an extra hat, or an ops director who is now human resources. There's so much liability that comes with that. So yeah, it's really important. And one of the things that we do that's really cool is every form in the system, whether it's environment of care or human resources or anything else, it's attached to the regulation that it meets. So think about it. You're an inexperienced compliance person, and you ask somebody to complete their fire drill quarterly, and they come back to you and go, oh, no, we don't need to do it quarterly. That only needs to be done annually.
Yep.
And why are you pushing my buttons to do this? I don't have time for this. And you can click a button and the regulation comes up and it says, well, according to 65D30, blah, 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 this needs to be done at this frequency. Now you've got that operations guy or woman or whoever it is going, I have the confidence to know that I'm doing the right thing and I don't have to second guess myself. And it just really provides that confidence to people that they're doing the right thing. So yeah, absolutely. Those situations are very helpful.
Mike, you're putting your finger on something I think is really important for a lot of operators. I'm very familiar with your system. And one of the things that I love about it is that regardless of your role within the organization, you actually have agency in terms of what your responsibilities are, as opposed to an operations manager or a compliance officer going around and saying, you do this, you do this, you do this, and people just have to respond to this amorphous to-do list. I do love the fact that people can log in and they can see, they're like, okay, I see what I'm responsible for this month, this quarter, this year. Maybe you can talk a little bit about what that does to make an organization more healthy.
Absolutely. Well, looking at the documentation and the things you need to do, that automatically gets sent to you based on the regulatory requirements. So where this becomes really helpful is you're not needing to program it. You don't even need to really know what the regulations are. The system's going to say you're a detox in Florida, you're going to get facility walkthroughs fed to you when it needs to be done. And you're going to get a 60-day notice, a 30-day notice, and a 15-day notice pushing it to you. So think about that stress of trying to not only understand what the regulations say, but then as the documentation I'm doing, meeting those regulations, that's a whole other thing that creates stress for people. And then of course, management being able to click a button and say, oh yeah, it's been done. So there's multiple levels of comfort that come from that. And, you know, again, if you have it fed to you when it needs to be done, and this is all based on best practices and years of experience, if that is done and you're not stressing about it, then your staff is a lot happier. And they're able to concentrate on what matters, which is taking care of the clients. You know, this is such a unique field. And our people don't join this. One, anybody in this field is here because we choose to be, right? I think that's something really important. This is a very unique kind of area of healthcare. And two, if they're here because they want to be, their goal is going to be to take care of the clients. That's so important. So if you're sidetracked with documentation or taking too long to complete documentation or not sure if what you're doing is right and then afraid you're just wasting your time doing it, it takes away from client care, which is why we're all here in the first place.
Yeah, you know, Mike, just staying on this topic, like when you think about like the impact 5 years out, like what do you hope your work at like Kipu enables for like patient outcomes and staff well-being, just staying on this topic?
Man, you know, I think when I first started, I'm just going to pull it back a little bit. When I first started, I thought I was selling software. You know, I thought that was what I came in to do, was to help Renee sell software. And as I dug in and started talking to providers about what the system did, and then started talking to users of the system, I started to see that it helped the people who were day-to-day helping the people. And that was really important. In fact, one of the first things I said is we're actually helping the people who help the people. And I think if I was to look at what this is down the road, it's how much time can we give back to the providers and to the caretakers to make sure that they have more time with the clients and they have more data to work with to improve care. That is the ultimate win for me. I mean, like we just discussed, we all have a personal reason for being in this field. And if I can help people give more care, better care, and help improve outcomes through compliance, then I've made my mark in the world. And that's really, that's why I'm here. And that's what I'm hoping to do with this.
And let's also don't forget that you cut down the 2 to 3 hour session, training sessions down that Renee was doing down to what, maybe 15 or 20 minutes now?
Yeah. Renee is hands down the most passionate person I ever met. Really, she just wanted to make sure that everybody knew how to best utilize this for helping people. And she's still, to this day, always just, what more functionality, what more features, how can I streamline this? How can I reword this to Sesame Street it so that the people who may not be as experienced can do this easier? And I can't.
I like that line, Sesame Street.
Sesame Street.
Yeah, it's a good line.
I mean, Sesame Street as a verb is really useful. I
Yeah,
think that's good.
that's good. That's good, Mike.
It's funny. We developed a term. I speak Renee. Renee speaks at a very high level, and sometimes it goes over people's heads. And you need me, or you need Chris, our other partner, to go, yeah, this is what regular people understand. and that's where that partnership has been really helpful, for sure.
We may have to ask Matthew, though. Matthew, you know what Sesame Street is? Matthew's our producer. You know Sesame Street, Matthew? Okay, all right, good. All right.
So Mike, our industry is at a really interesting inflection point right now, and there are just as many founders and just as many people that are trying to develop platforms and ideas and things like that. And in so many ways, you and Renee have had sort of the perfect founder story. It's also curious to me that when we go back to when we started this conversation, you were talking about how Renee's a lot like people in this industry where they do something based out of need. And then the idea of professionalizing sales or professionalizing marketing comes after the fact. So with that setup, I'm really curious, what advice do you have to people that are sort of on their own founder journey, or they're on sort of an inventor journey or a developer journey? What would you say to them based upon your learned experience?
There's a few things. Don't take advice from everybody. If you take advice from everybody, you're going to get such a varied group of responses that you're going to be chasing your tail, and you're going to have this paralysis by analysis, and things are not going to get done. Have a trusted group of advisors, small group of advisors with varied skill sets that you can ask questions and get reliable answers. I think that is very, very important. 2, surround yourself with people on your team with varied skill sets. I've had several businesses in the past that didn't work, and looking back on them, I've realized that there were too many of the same skill sets on that team, and it wasn't varied enough to be able to get me across the line to the next level. And so I think that was a second thing I would say. And the third is, if you ask for money, you're going to get advice. And if you ask for advice, people may give you money. And I think that's really important, and that you take that advice, right? You guys are laughing, but you've been there,
well,
right?
You just Sesame Streeted the whole story right there.
I have a great story about that we'll have to share when we've got more time. But yes, there was a time when we needed money, and I went to somebody and I asked for the money, and he says, you need to learn how to run this business first. And if I can make a suggestion to anybody who's a founder who's looking to meet people, and I know you guys all deal with founders, is there's a great group called A Million Cups. I don't know if you're familiar with it. A Million Cups, it's like 1 million cups of coffee that they've given out. And it's kind of like a little Shark Tank company. They've got chapters everywhere across the country. And that was where I learned how to pitch. That was where I met some great people. And so, again, a great organization. I really got a lot out of A Million Cups.
We need to put that in the show notes.
Yeah, we will.
Yeah.
Definitely. Well, Mike, it's amazing, your story, and it's also even more amazing, like the passion that you've got behind what you do in the industry. And I know, one thing I've learned about you is just you're a fierce competitor too. And I know you're an avid cycler, and we had a funny conversation, and that I was hoping that when Mike was in town, we may ride together. But after hearing how fast you ride, I don't. You wouldn't enjoy
Yeah,
it at all.
I'm not sure I want to show up with my bike.
Well, there's an expression that says "read the room," right? And whether you're an elite level rider or you're a beginner rider, if you ever rode with me, I'd be able to read the room and ride at whatever level that is. Respectfully, no, it
Mark
doesn't.
and I
it
go
doesn't
far.
matter.
We just go slow.
Yeah.
Go for a cruise up to the coffee shop. I'm totally cool with that. There's just something about being on two wheels that is magical.
Yeah,
It's always
anytime on a bike is a great time.
Yeah.
That's for sure.
Yeah.
Mike, we've spoken of Renee, and obviously she's not here today, but want to send our best wishes in regards to her, and congratulations to her, and all the things that you guys have managed to do. And you've proven that a husband and wife can make this work. So it's super inspiring to everyone, I think.
Thank you. Again, we talked about varied skill sets, right? I couldn't never do what she does, and she doesn't want to do what I do. So we stay in our separate lanes, and we don't really bring it home with us, and that's really been really helpful. But it can definitely be done.
Well, as we're kind of wrapping things up, Mike, is there anything that we haven't talked about that while you have the opportunity, you can just kind of flop it out there?
I think
Well, are you going to let listeners call you for advice now?
I got to say, I am always open to that. I've have people, I try to keep myself as an open book. I genuinely think this industry is special. This industry has changed me. And if I can ever give back to anybody, if anybody has any questions or anything, I have my phone number on LinkedIn. I do get a lot of spam and stuff from it, but I'm open to it always. I love hearing from people with ideas who want to do something different. Just don't call me and ask for advice and then tell me why my advice is wrong. You know what I mean? That's not cool. But absolutely, like I people who are genuinely trying to do the right thing, I want to connect with you. I think that anything I can do to give back to people who are trying to move this industry forward and to try to help people, I want to. So absolutely, anytime.
Great, Mike. Well, hey, thank you for being a part of MasterMined, and thanks for sharing all your thoughts about Kipu Compliance and the journey and where you see the industry going and your passion. Really appreciate you sharing all that with our audience today, and we wish you the best, and we know you're going to continue to just thrive. So thanks for being a part of the show.
Thank you very much, guys. It was great seeing you, and I'm excited for the next conversation.
All right, Mike, we'll see you out there.
See you.
Thanks, guys.
That wraps up this episode of MasterMined. Thank you so much for joining us. And remember, MasterMined is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on MasterMined, your behavioral health playbook.